More than 20 years ago, we approached our community with a vision to build and equip a state-of-the-art hospital in Northumberland County. Together, we brought this vision to life, and Northumberland Hills Hospital has stood proudly as a beacon of our community's strength since 2003. NHH is our hospital, and it needs our support. With significant capital investment on the horizon, we are undertaking the largest campaign in Northumberland County's history to ensure our community continues to have access to exceptional care close to home. Thanks to generous community support, we have made great strides towards our goal of raising $25 million. But we are not there yet. We witnessed the transformative power of philanthropy when we came together to build this world-class facility. And with our community growing, our hospital needs us yet again. It's time for us to come together in support of our hospital. The success of our Exceptional Community, Exceptional Care campaign will ensure you, your loved ones, friends, and neighbors have access to the best care possible.
It's time.
It's time.
It's time to prepare for growth.
There are many needs facing our hospital. We're about to enter into our 20th year anniversary, and we've had a rich history of support from our community. But with any building that is starting to age, there's needs in terms of new equipment, there's needs in terms of replacing existing equipment, and then there's also the needs that we have in terms of our future growth. There are many things that we need to consider when we think about our aging and growing community. On the one hand, we know that there will be an increase in the need for services. We know that as our population ages, that more work will need to be done to support individuals with chronic disease conditions. We also know that having growth in the community means that we need to be considering new programs and services that we currently don't have within our walls. And so there are many different facets that we need to be thinking about when we think about supporting the needs of a growing community.
It's time.
It's time.
It's time to invest in our hospital's future.
To me, community support of our hospital is something very special. It's something that I've seen for the last 18 years. One of the anchors of this community is this hospital, and so if you want to live here, this is part of what you have to support. This is kind of a jewel in the crown.
Our patients are the most important people in this ecosystem of healthcare, and the hospital is a part of that very important ecosystem. So having the hospital being well equipped attracts talent. The talent facilitates better care. If a person is having a heart attack or stroke, it should not depend what their outcome is going to be where they live.
I think the benefits that community support brings to our hospital has a lot to do with the technology that we've been bringing in. It has to do with being able to get imaging done at our own hospital instead of having to go further afield. It means that people can be looked after in their own community, close to their families, in a place where they're comfortable. And I think that's the most important thing.
Well, I woke up feeling lousy, got up, got dressed, sat downstairs, put on the TV thinking I'd sit up and watch TV a while and I would start to feel better. I didn't, and then went upstairs and woke Dean up to tell him I wasn't feeling well and that I thought I should go to the hospital. Went into the emergency and spoke to the nurse at reception and told her I thought I was having a heart attack. And they took me right in. A couple of minutes later, the doctor came out and told me I was having a heart attack and that things would move quickly. And they brought Dean in and I took a deep breath and collapsed.
Nurses and doctors came from everywhere. There was probably, I'm going to say 8 to 10 of them that were overseeing Tim, and then all of a sudden they told me to leave. They put paddles onto Tim to resuscitate him. It was like a well-oiled machine. Everybody knew exactly what to do. Their timing was impeccable. They wanted to make sure that I was fine, which was very compassionate for that team that were working that evening as well.
I think it's important to have a well-equipped hospital. If we didn't, and we didn't have the proper staff, I wouldn't be sitting here.
It's time.
It's time.
It's time to come together.
We all know someone who's been impacted by the exceptional care close to home that NHH provides. This is why I'm honored to be serving as chair for the Exceptional Community, Exceptional Care Capital Campaign. Northumberland County is more than just a place on a map to me. It's where I chose to raise my family, run my business, where I've made both lifelong and new friendships and countless memories. I love this community, and I'm confident that together we can ensure our hospital remains vibrant and can continue to offer the quality of care our families, friends, and neighbours deserve. Northumberland Hills Hospital is a cornerstone in our community. It is an economic driver for West Northumberland, and ensuring access to advanced medical equipment will help attract and keep both talented medical professionals as well as new residents and industries.
It's time
It's time.
It's time for action.
We have hope.
for a bright future.
We didn't come this far to just go this far.
As successful as this campaign has been to date,
That doesn't mean there isn't more to be done.
We are no longer in the think tank phase, we are in the action phase.
Together, we can ensure our exceptional community continues to have access to exceptional care.
Our community needs a strong hospital.
An investment in our hospital's future is an investment in our community.
It's time.
It's time.
It's time for faster, smarter, connected care.
Individually, we can only go so far.
But together, we can go so much further.